Hi everyone, my name is Dr. C van Zyl, popularly known as Dr. Cindy, and I'll be chatting to you about HIV. So we live in a country with about 7.1 million people that are living with HIV, and just over 4 million people are on antiretroviral treatment. So this is great. We've made great progress from the time that we started rolling out treatment, but there's so much more work to be done. And your role as nurses is to make sure that everyone gets tested for HIV. I think one of the most amazing progresses that we have made. I started working with HIV in 2008 because I had done my internship at Baragwanath Hospital in Soweto, and I'd seen so many people dying from AIDS-related illnesses. And I think something happened in my heart at the time that made me decide that I want to work with HIV. So since 2008, I've been working solely with HIV. We've made so much progress in the last 10 years. I mean, we've come from a time when people were taking 7 tablets in the morning and 7 tablets at night, and now people take 1 tablet in the evening, and so we've made great progress. Another thing that has happened is that we've made progress in terms of prevention of HIV. So yes, condoms still do have a place, but we now have 3 things that I'd like to talk to you about, and those 3 things are very, very important. The first thing I want to discuss with you is, of course, the basics of HIV. I never take it for granted that people know what HIV is. So we're going to go through HIV 101 very quickly. If it's boring, I'm really sorry, but as I said, I never take it for granted. So first of all, HIV stands for Human Immunodeficiency Virus. Human, it occurs in human beings. Immuno, the immune system. And deficiency means that it affects your immune system in an adverse manner. What does HIV do? HIV attacks your CD4 cells. It causes these cells to stop doing their normal function. What's the function of a CD4 cell? The CD4 cell is a very important part of your immune system. These cells protect you and they keep you strong. HIV uses those cells to make copies of itself. So as you can imagine, if you're infected with HIV, your CD4 cells are being used for something that they were not meant for, and they start going down. They start dying, they start producing HIV copies, and they start dying in the process. And the lower your CD4 count is, the sicker you get. And the sicker you get, the more likely you are to pass away. We don't want that to happen, and this is why it's so important for people to know their statuses and to make sure that once you know their status, you start treatment as soon as possible. In terms of treatment, the options that we have, we give 3 or more antiretroviral drugs to treat HIV. So we never treat HIV with less than 3 drugs. I have a patient, a 16-year-old girl, and she's on 5 drugs, and we call that salvage therapy. So salvage therapy is when your virus has mutated a lot, and we're now giving you more than 4 drugs just to keep you going. And there's nothing wrong with salvage therapy. It works really well. It's just that you have a higher burden of pills. But most people are taking 1 tablet a day, and the medication works very well. How do I know that the medication is working? I will check your viral load. So viral load is the amount of HIV copies in your blood. So every 6 months, once you've started treatment, I'll do your blood tests. And what do I want to see? I want to see that your viral load is undetectable. So undetectable means you're still living with HIV, but you're taking your treatment so well that the virus is not reproducing anymore. So you're still HIV positive, but the virus is no longer producing. And this is something that is very important for you guys to understand and to make sure that you're able to explain this to patients, because some patients mistakenly assume that because their virus is undetectable, they're no longer living with HIV, and that's wrong. If you're undetectable, you're still HIV positive, but your virus is controlled. So moving on to how HIV is transmitted. I always include this because I know that we have different ideas of how HIV is transmitted. HIV is primarily transmitted through unprotected sexual intercourse with a person who has a high viral load. So I'm going to repeat that because it may be different from what you've heard before. HIV is transmitted by a person who is HIV positive and has a high viral load. Unprotected sex with a person who's HIV positive and has a high viral load. Meaning, if you're HIV positive and you have an undetectable viral load, you can't transmit the virus, but we'll cover that a bit later on. The second way that HIV is transmitted is during pregnancy, breastfeeding, labor and delivery. But we've worked so hard to make sure that women who are pregnant are all tested for HIV, and if they're positive, they start treatment. And this is really how we've prevented babies from being born with HIV. That's a very important program. And again, your role as nurses is to make sure that every single pregnant woman that you come across has been offered an HIV test, has been counseled, and has been tested. That is how we would make sure that babies aren't born with HIV. The third way that you can contract HIV is obviously in our profession through occupational exposure. So needle stick injury happens, but the rates of contracting HIV in that way is very small. And also we have PEP to make sure that you don't contract the virus. The last way in which people used to get the virus is through infected blood products. But the SANBS has got a fantastic system where they screen all blood products, and we haven't had any transmissions for many years. So those are the 4 ways in which a person can contract HIV. How do you not get HIV? So you don't get HIV from casual contact, from sharing cups, sharing plates, from kissing, from hugging, from shaking hands, from oral sex. You do not transmit HIV in that way. And you need to know this because patients are going to ask you those questions, especially with the kissing and the oral sex. There isn't enough virus in saliva for HIV to be transmitted in this manner. So please, I hope you understand this. You can't transmit the virus through kissing or oral sex or hugging or shaking hands or sharing toilets. So I hope you're feeling optimistic about HIV. I think one of the reasons why I do what I do is because there's so much doom and gloom when it comes to HIV. And I always say to people, HIV stands for hope is victory. Your duty is to make sure that your patients feel as if it's not the end of the world, because it really isn't. And I know that you guys are doing a fantastic job of testing people. When you break the news that someone is infected with HIV, don't make it a sad event. Let them know that everything is going to be fine. If they start treatments, they can live a long, happy life. HIV is not a death sentence. Okay, so moving on. PEP. PEP stands for post-exposure prophylaxis. So what is post-exposure prophylaxis? It is treatment that we give to prevent a disease or infection. So PEP is 3 ARVs that are given when you've been exposed to HIV. Which drugs do we give? We give the generics of Truvada. Truvada is a 2-in-1 antiretroviral drug. And we also give a drug called Icentris. Icentris is Raltegravir, but the brand name is Icentris. So Truvada and Icentris, that is the gold standard for post-exposure prophylaxis. In the past, we had different drugs, but those drugs had side effects. And the thing with PEP is that it must be taken for the full 28 days. But now, if I give you something with side effects, you're not going to finish the course. So that is why we have changed, and we now give Truvada and Icentris. How do we screen you for PEP? If you come to us and you say to us you've had a burst condom, or you've been sexually assaulted, or you've had a needle stick injury, the first thing that I have to do is test you for HIV. If you test HIV negative, you qualify for PEP. This is extremely important. You have to be HIV negative to be given PEP. Once you start the PEP, you don't skip any doses. You must finish the 28-day course. One of the challenges you're going to face, especially if you're dealing with health professionals who've been exposed at work, they almost always want to test the patient, right? And I always say no. The patient is you. You've had the needle stick, we are concerned about you. We're not worried about the source patient. I don't really care what the source patient has or doesn't have, whether they're HIV positive or HIV negative. That's none of my business. I'm concerned about you. So if you've had a needle stick injury, we are testing you. If you test HIV negative, then we start you on PEP. So I hope I've made that very, very clear. 28 days, we'll test you at the end of the course, and we'll test you again at week 12. Week 12 is your exit HIV test. If that test is HIV negative, then you're confirmed HIV negative. The next concept I want to introduce to you is a concept called PrEP. So PEP was post-exposure prophylaxis. PrEP is pre-exposure prophylaxis. Pre means before, exposure to the virus, and prophylaxis, treatment that is given or taken to prevent a disease or infection. So PrEP is something that's quite new and something that's extremely important, especially in our setting. So who qualifies for PrEP? Everyone that perceives themselves to be at risk for HIV infection qualifies for PrEP. And when I say everyone, I mean everyone. If you are sitting in this room and you believe that you are at risk of HIV infection, be it in a relationship setting or any other setting, you qualify for PrEP. What are the conditions to access PrEP? You have to test HIV negative. So you come to me, I'm an HIV clinician, I test you for HIV, you test negative. I'll do an STI screen, and if you have any STIs, I shall make sure that I treat those. Once you have tested negative and it's confirmed, I'll start you on PrEP. And what is PrEP? PrEP is 2 drugs in a fixed dose, and we give Truvada or its generics. So Truvada is the originator drug, and the generics are Emtivir, Tenamine, Tyrek-10. There's quite a few of them on the market that are actually quite affordable, but that is what we give for PrEP. How long do you take PrEP for? You take PrEP for as long as you perceive yourself to be at risk for HIV infection. And how long do you have to take it before you consider yourself to be protected? You must take PrEP for 20 days if you'll be engaging in vaginal sex. So before the 20 days, you are not protected. So during those 20 days, you're either abstaining or you're using condoms. If you're going to have anal sex, you must take PrEP for 7 days before we consider you to be protected. So PrEP is something that's very, very important, and I think it's something that should be on every billboard in our country. So I'm saying to you, there's a tablet that you can take to protect you from contracting HIV. Do I care what you're doing behind closed doors? Do I care what you're doing in your bedroom when no one's watching? No, I don't. My duty as an HIV clinician is to assess your risk, and if you deem yourself to be at risk, then I need to start you on PrEP. I screen you for STIs, I test you for HIV. If you're HIV negative, you start the PrEP. What happens if you want to stop the PrEP? You can stop it, but we need a 28-day lead out. So you don't start it on a Friday and then go and have fun over the weekend and then stop it on a Monday. No, you must take it every day for it to work. And if it's taken properly every single day, it has an efficacy of more than 90%. And that's fantastic news, because I feel that PrEP, the pre-exposure prophylaxis, plus PEP, post-exposure prophylaxis, together can help us to prevent new HIV infections. Is there an age limit for PrEP or PEP? No, there isn't. I mean, most of us are fully aware that people are being sexually active at younger and younger ages. And you know that in this country, from the age of 12, kids can access contraception. So we can't stop them from accessing life-saving treatment. And I always say to nurses that we can't afford to be judgmental. I know it's very difficult for many of us because most of us are mothers or aunties or grannies, and sometimes when you're confronted with these situations, it's very easy to put yourself, first and bring your opinions to the table. We can't afford to do that. We want to save lives, and that is why it's important for our clients to be able to access all this treatment in a safe environment where there's no judgment. The last concept that I feel is the most important one is something called U equals U. So U equals U is a movement that was started in 2016 and has really spread around the world like wildfire. U equals U stands for undetectable equals untransmittable. So what does undetectable equals untransmittable mean? It means that if you are living with HIV and your viral load is undetectable because you're taking your treatment well, you cannot transmit HIV. So I know that it's shocking to most of you, because whenever I teach about U equals U, people's eyes get very wide like saucers. U equals U means if you are living with HIV and you're taking your treatment properly and your viral load is undetectable, you cannot transmit the virus. This means that you can have sex without a condom and not infect your partner. So do you realize how life-changing this is? In the past, we used to tell couples where one partner was negative and one partner was positive that for them to have a baby, they needed to have IVF or semen syringing and all sorts of other expensive things that they had to do. Those times have changed. U equals U has changed everything. If you're living with HIV and you're taking treatment and your viral load is undetectable, you will not transmit the virus. And I think in the last 2 years, sharing that message has brought me great joy, because I've given people hope. I'm saying to you that you can be infected with HIV, I'll start you on treatment, and within 12 weeks of starting treatment, your viral load will be undetectable. If your viral load is undetectable, you can then stop using condoms with your partner, provided you've disclosed your status. And this means you guys can have babies, you can do whatever you want, as long as your viral load stays undetectable. And I think it's important for you guys to know this, and it's important for you guys to also carry on researching about it so that you can understand the message, digest it, and be able to share this good news with other patients. So I hope that I've taught you interesting stuff. I hope you've understood it. I'm really sorry I couldn't be there with you, but I will give you my cell phone number because I do a lot of social media work and I also do a lot of WhatsApping with nurses. I'm always available for you to ask questions. So if you ever have any questions, if you come across a case that doesn't make sense to you, you can reach me on 073 414 0016. And lastly, people always wonder why my surname is Van Zyl. I'm married to an Afrikaans guy, so I'm actually Mahamba Sithole, that's my maiden name, and I'm married into an Afrikaans family, and that is why I'm Sindisiwe van Zyl. I hope you enjoyed the talk, and I look forward to seeing you soon.